So ankle sprains are hugely common, and the vast majority of ankle sprains that occur, we never see in hospital. They never come to see their GP. They never attend A&E. People recover from these, for the vast majority of cases, spontaneously, without any sort of medical intervention. The first thing, I suppose, and perhaps the most important thing, is to make sure that we're definitely dealing with an ankle sprain and not a fractured ankle or a broken ankle or any other sort of significant problem. So I think in the first instance, you have to think carefully about how you've sustained the injury, the mechanism of injury, what actually happened to your ankle. And generally speaking, ankle sprains happen often relatively low energy. It's following a relatively low energy accident or an injury. You missed your step, you came down some stairs awkwardly, perhaps you were running, caught your foot as your foot was hitting the ground and it twisted. And that's the key. It's a rotational or a twisting type injury. And in the vast majority of cases, it will be an inversion of the foot underneath the leg. And as you invert that foot, you damage the ligaments on the outside of your ankle. Often people hear a snap or they feel something tearing. And almost immediately, it's very difficult to bear weight. There's often a lot of bruising, perhaps some bleeding under the skin. People often describe seeing an egg or a large swelling which appears on the outside of their ankle. And that happens normally pretty quickly, certainly within an hour or so. I think the important thing to differentiate between an ankle fracture and an ankle sprain is the ability to weight bear. And if after the initial shock and trauma, I suppose, has subsided, if after an hour or two you're not able to bear weight on your ankle, then that's a risk factor or a sign perhaps that there might be something more serious going on, such as a fracture or a broken bone. And if that's the case, I think you should get an X-ray. But provided you've got that classic history of that inversion injury, the swelling on the outside of your ankle, and you are still able to bear weight, albeit painfully, chances are this is a simple ankle sprain. And as with all soft tissue injuries, the first thing to do is to rest the foot, to elevate it and try and reduce the swelling. And there's this acronym which is fairly widely used, especially amongst the sort of physiotherapist community, RICE, which stands for rest, icing, compression, and elevation. And those 4 steps are very helpful in the first 48 hours to help reduce some of the inflammation. By getting the swelling down, reducing the inflammation, keeping your foot up, icing it, not overloading the joint, your pain should hopefully have significant improvement over the first 24 or 48 hours. Again, you've always got to have in the back of your mind, is this more than a simple sprain? And I think if after 48 hours, it's still significantly swollen, it's still significantly painful, and you're having difficulty bearing weight, then you've got to think to yourself, is this perhaps a fracture more than a sprain? And you should probably seek some medical advice. The overall recovery time from an ankle sprain, it can be quite a long time. People often think, oh, it's a sprain, it's a minor injury. And of course, there's a whole spectrum of severity of disease and the whole spectrum of sprains. There's the very minor sprain where the ligaments are just perhaps slightly stretched, but there's no significant tearing. And in most cases, that'll settle down within 24, maybe 48 hours. If there's been more significant damage to the ligaments, then it can sometimes take several weeks to fully improve. People often say to me, how long should I wait before I go back to sport? And of course, everybody's different. The more severe sprains, I think realistically, it can take 6 or 8 weeks to return to high levels of activity. And of course, it depends what sort of sport you want to go to, what sort of sporting activity you want to try and get back to. The simplest things are cycling. Yes, cycling is a great exercise for an injured ankle because the ankle's not going to twist, it's not going to invert. You've got your foot planted on the pedal, using a cross trainer in the gym. Again, you're not going to twist your ankle on a cross trainer. Moving up, you can then go to perhaps brisk walking on a treadmill, even some jogging on a treadmill. At the higher level of activity, this sporting activity where you're running perhaps on uneven ground, you're playing football, activities where you've got to suddenly change direction, that puts a lot more sprain on, it puts a lot more stress rather on the ankle ligaments. And clearly your recovery from that is going to be significantly longer. So how do you recover from an ankle sprain? In the first instance, rest, ice, compression, elevation. Make sure you've not got a fracture. Take it easy for the first 48 hours or so. Anti-inflammatories, if you can take them, are often particularly helpful. And then see how you go. And then a gradual return to activity as your symptoms allow. Okay, so should you avoid moving your ankle when it's sprained? It's a question that's quite commonly asked. And I think in the first instance, when the ankle is desperately painful, the ligaments, the soft tissues are all inflamed, then it's useful just to rest that ankle. And you don't need to be strict about not moving it, but you shouldn't overdo things. We go back to that rest, ice, compression, and elevation. But for the first 24 or 48 hours, I think it's useful just to take your weight off the ankle, offload it, keep it elevated, and don't do too much whilst the initial inflammation and swelling settles. Do you need to be absolutely strict about not moving it? Well, no, you don't. In fact, gently moving the ankle, putting it through a simple range of movement, moving your toes up and down, getting your ankle gently moving, inverting, everting it without any load on it is actually very helpful in pumping the fluid out of the soft tissues, getting that swelling to come down. After 48 hours, you then need to start thinking about getting that ankle back into action again. And as we said in the previous question, there are severities, various levels of severity of ankle sprain. Those with a more significant soft tissue injury, it may be more like a week or two until you can get back to this. But gently getting the ankle moving, putting some gentle load through it in a controlled fashion, walking on flat ground rather than uneven ground, that's a really helpful thing to try and get the muscles, the ligament working again. In fact, if you immobilize an ankle for too long, if we were to put you in a boot or put you in a plaster or strap it up for too long, the ankle actually can get really quite stiff, which then makes your future rehabilitation much, much harder. So initially, in that initial phase, yes, you should rest your ankle, but you don't really need to immobilize it. After 48 hours, you should then gently try to improve that range of movement. Gentle weight bearing, getting the ankle back into function. People often say, should I buy a brace or should I strap it up? And you can spend a fortune on braces. You just need to look on the internet and you can spend hundreds and hundreds of pounds. And most of the time, this really isn't necessary. Where a brace can be helpful is in the later stages of your rehabilitation. One of the big issues we have is that as you're recovering from the ankle sprain, the muscles which control the inversion and the eversion of your ankle aren't working properly. So you need to try and get them back into action. And this is really where physiotherapy comes in. And I think certainly if you're still struggling after an ankle sprain at 3 or 4 weeks, seeing a physiotherapist is a really helpful thing to do. But in this stage, actually an ankle brace can be quite helpful for a short period. It's going to stop you twisting the ankle again or inverting it again, particularly when you're doing activities such as walking on uneven ground, or you're in a situation where you think you might be at risk of twisting the ankle again. But it shouldn't be a long-term solution. And I hope, that the majority of people would be able to get out of the brace after 4 weeks, something like that. So the vast majority of patients who have an ankle sprain will recover uneventfully with no intervention at all. In fact, 95% of people will never see in the clinic. They'll get better and they don't have any issues at all. And this is without doing anything special. No physiotherapy, no rehabilitation, no ankle braces, just getting on with it. And their ligaments will heal up. They'll be sore for a week or two. And that's the end of it. There is a proportion of people, probably 1 in 20, will have some ongoing issues. And that can manifest in a number of different ways. Pain sometimes is an issue. Persistent instability, so an ankle that keeps giving way, or stiffness, so an ankle that just won't get back to that normal physiological range of movement. And in those cases, in the first instance, I think if you find yourself in that cohort of patients, and we're probably talking 6-8 weeks after the initial injury, if you're still struggling, then I think in the first instance, some physiotherapy is absolutely important. And the physiotherapist will be able to assess the function of your ankle, see what they need to work on with you to try and improve your function, get the muscles working in a coordinated way. This is something called proprioception, this unconscious awareness of what your ankle and what your muscles are doing. But for most cases, that will be sufficient. There is a very small minority of those cases who will go on to either have persistent pain or persistent instability. And in those cases, sometimes surgery is an option. In the first instance, we would want to image your ankle, normally with an MRI scan, often combined with a plain X-ray, to make sure that we've not missed an old fracture and to see the severity of the lateral ligament injury. I think then if after several weeks of conservative management, so physiotherapy principally, if you're still struggling either with persistent pain or persistent instability, sometimes there is a role for either an ankle arthroscopy, which is keyhole surgery to look inside the ankle, take away any scar tissue or inflammation, and address any other pathology that you might find there, such as damage to the cartilage, or a lateral ligament reconstruction, which is whereby the ligaments on the outside of the ankle are tightened up and reattached back onto the bone to restore stability to the ankle. And in some cases, we end up doing both, an ankle arthroscopy and a ligament reconstruction at the same time. But the vast majority of cases will settle with conservative management. And if you're still struggling after 6, 7, 8 weeks, perhaps some physiotherapy is a good first step.